What does advocacy look like these days? Well, my guest joins us to discuss some practical, real-world strategies. You're listening to the PHEC podcast, episode 406. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I'm hosting a different type of conversation on this episode. My guest is the only person so far to return to the podcast for a third time. That's right, he just scored a hat trick. Now, just in case you're wondering, what's a hat trick? It's a reference in soccer often. I'm a retired soccer mom, so that's where I got it from. And it refers to when a player scores 3 times in one game. So my guest is returning for the third time. But his name is Dr. Oscar Alleyne, and you'll find out exactly why I specifically chose him to have this conversation with. By the way, did you know that we've launched an app for this podcast? Well, when we celebrated the 400th episode milestone, I knew it was time for something really different and new, and we've been shaking things up. So I made the decision to invest in creating a special community without the distractions of social media or ads. The PHEC podcast community is a space where public health professionals connect, collaborate, rest, relax, and grow beyond the weekly podcast episodes. In this community, you'll join a global network of public health practitioners who are sharing insights, resources, and opportunities in a safe and healthy environment that's free from social media distractions. You can download the PHEC Podcast Community app in Apple or Google Play Store. Links will be provided in the description of the episode, and I encourage you to download that app. You'll also find links in the show notes. But the big question for this episode, what does advocacy look like these days, especially at the local level? Well, that's exactly what we're diving into and having a real, practical conversation, which may feel a little bit like a brainstorming session in some ways. I think you will leave energized and with some good, actionable next steps. That's how Dr. Alleyne and I felt at the end of our conversation. So let's connect my conversation with Dr. Alleyne right now. Well, hello there, Dr. Alleyne. Thank you for joining me again. How are you?
Hanging in there, great. Always a fun time here at PHEC.
Right. Yes. I'm really excited that you were able to find some time to chat with me today. I knew I wanted to hold this conversation. I was thinking of the best person to do it, and you immediately came to mind. You're just a regular here on the podcast. So I remember when we cycled around, I decided to bring back guests. For a long time, we didn't have any repeat guests. So you are our first repeat guest. So now you're the first person to come back for a third time. So this is a hat trick here.
I'm just excited and really pleased that you find that much confidence to have me come a third time and hang out.
You are the person that I really want to have this conversation with. And to really put into context, we're going to kind of jump into it because I will reference and I'll share links to the previous episodes. So for folks who are not familiar with you and your background, to deeper dive, but I really want to hold a conversation around that I feel will be empowering, just kind of addressing the state of where we are right now here in our United States with the shifts, so many shifts since the Trump administration, change of presidential administration here. We've navigated the first quarter of it. And at the time we're recording this, I have to put it into context because there just seems to be so much chaos that shifts. So right now, this is the beginning of Q2 at the time we're recording this, in case you're listening to this and some of this feels like really dated. But I just wanted to have a conversation around policy advocacy. Like, what can we do as individuals? Because everything that we hear about, it feels so much out of our control. And I just want to have a grounding conversation around what we can do, as individuals, public health professionals of all, we have a range from students to senior career professionals and all the mixture in between, a lot of interdisciplinary folks that come from different backgrounds into public health. But just kind of having a grounding kind of a conversation. Before we dive immediately into, I guess it would be fair to do some brief introduction, just kind of who are you? And you have a very extensive background with our American Public Health Association Executive Board. And that was one of the big reasons I thought of you. But if you could just do a brief introduction, your background would be helpful.
Oh, wow. I'm a consummate epidemiologist, right? I would start there, always having a love for biology to that extent. But really, my trajectory in my career has really been focused on governmental public health, both from a local, national, state, and global perspective, and really trying to provide thought leadership, innovation, and of course, just the flavor of recognizing we're a quintessential community that's globally connected on a local attribute side. So those are the aspects. I spent a number of years, a couple decades in local public health in New York before moving on or graduating into the national lens of being on the National Association of County City Health Officials, where I was the chief program officer there for a number of years, and then subsequently heading up a public health division at MITRE's FFRDC for a few years, and really remaining grounded in the role of public health. And as you mentioned, being very active on the American Public Health Association, as well as other academic and other partnerships, and even sitting and serving as an individual on the PHEC for the Defense Health Board for a number of years as well. So that's me in a nutshell, but try not to do too much of self promotion to that extent.
No, that's wonderful. Thank you for sharing that introduction, which is always, it's very uplifting. I have some pretty awesome friends. Well, I really do, in all honesty, I do appreciate your style, your approach. You are very much a very passionate leader, and you bring the things that are very technical and complicated, and you do present them in a way that is more relatable and very practical. And that is something that, I lead with in the work that I do. And one of the reasons I wanted to have this conversation with you. So just kind of speaking to, kind of like I said, where we are, I pay attention to what my colleagues are saying. It's hard for us to scroll or touch anything on social media. And I primarily am on LinkedIn without there being this sort of doom cloud. So much is happening. Everything is heavy. And I keep thinking about how do we turn this around? And not that I'm trying to solve the world's problems, but really just thinking about preserving our industry, our leaders who are so exhausted. Even speaking for myself, sometimes it feels like, well, why am I going to use the energy I have to do this? It's not going to matter. Although at the same time, I keep having this little voice, and I see it all the time about the impacts that we have on a local level. I have started to make some kind of stepped up my, local game, so to speak, and becoming more involved and paying a little bit more attention and trying to connect, because I feel like on the local level, there's some things that, I could do and change. But at the same time, it still feels very overwhelming. So it's like, I want to do something, but then again, I really am going to kind of preserve myself. So let's talk a little bit about just that. Like, what can we do as individuals that can actually make a difference?
It's a very poignant question, and it's one that really takes several different shapes. From the perspective of what individuals can do, even the experience of it itself, right? We always talk about health not just being the status of disease, but the whole perspective of wellness, the completeness, the whole approach, right? When we speak about policies, we talk about health in all policies for a number of years. And we've even reconciled that when you look at our field of public health, it has always operated from a sense of not really shining a light on itself, just plugging away, knocking things out, moving on to the next issue, and really trying to be that kind of community support, that glue, that elastic, that foundational element without necessarily bringing fanfare to it. Now we're in a state of affairs where all focus is on. And there is a significant degradation of not only our workforce, but as you mentioned, the aura, the environment, the complexities, everything is turned upside down on its head. So how do individuals who work in a sense of always running into the firefight, for lack of a better word, into the issues to help solve and protect the wellness of communities, how do they deal with themselves being the targets or themselves being denigrated or even their careers turn on its head? So those are all things that can exacerbate anyone, right? And more specifically from the lens of the lessons that we know and the lessons that we've been taught and the things that we've really relished, it just seems like, has all this been worth it? If this is the outcome of years and generations and decades of learning about compassion, empathy, addressing things such as trauma-informed care and trauma-informed practices, all of these elements, psychological first aid, how do you manage and navigate that when it's focused on you? So I think it can put people in the tailspin, but the biggest thing that I think that drives me through this time period is the understanding that public health has always canonized the concept of resilience, whether it's community resilience, whether it's systems design and all those elements. So your perspective on what can you do, you have to maintain a positive mental attitude because it has to be grounded on the resiliency of the community, of the industry, of the field, of the individuals to be able to navigate these rough waters and find that North Star, as we would say, that allows us to continue to fight for what we know is right, which is for ultimately the health and wellness of all individuals around us. So that sounds kind of, okay, pie in the sky, but how do you do that, right? How do you build resilience when you are literally upended? And that's where I think the ability for us to build and strengthen our network and be that supportive network like what we're doing now, right? Having those communication strategies, looking at how is the network responding and how we can provide that collective support. What are the tools that we have for engagement? How do we even think around things such as self-sufficiency that we talk about and the value of partnerships? How do we really leverage that social connectedness, both from within and without, to really strengthen that, build that perspective that we have on what true resiliency and partnerships can give us and make those levers to help us navigate these waters? I hope that makes sense.
It does. It really does. I think that some of us naturally have done that, but I think that the way you're framing it, we need to realize and kind of embrace that this is an essential part of how we can stay intact and remain positive. Like you said, I think about resilience, and I've made the comment, and I've heard other colleagues make the comment, like, I think about resilience in my own family, in my own ancestry, in the lifeline. You think of my ancestors that were slaves and the resilience of the people through horrible times. I think about some of my friends and their ancestors that survived the Holocaust and indigenous peoples. And so we have, even if you don't know your line and you can't connect, borrow somebody else's story. We just have a history of resilience in people that we can pull from. And I think that, some of the things you mentioned, having the positive attitude, it doesn't mean that it's like, oh, yes, it's sunny day when it's really crappy. It is, call it what it is. But it's about, okay, so what are we going to do and how are we going to approach that? And then that whole thing of staying connected with network, because I find that in some cases, we have to kind of block certain things out. Like, I just can't allow a lot of things in because of kind of preserving myself in my own space. But I do reach out to my colleagues and do those check-ins. How is it going? How are you doing? And staying connected with those that are moving and shaking, or supporting those that are really boisterous and out front, supporting them from the background and things like that. So really strengthening the network in that context. So hearing you just kind of, I know what I've done, maybe others listening, the first thing is like, okay, well, I'm doing something and I'm in the right direction. And it is very helpful.
It is. And the one thing that I would always say when I speak to colleagues, even early career professionals and students in this type of scenario is that you can't despair. I think about it in the sense of even my own personal experience. So when I was at Rockland County, after dealing with the major catastrophe surrounding, as we say, the outbreak, I should say, surrounding West Nile, I had and we essentially had deployed a community-wide call center, which I had to navigate to talk about health and wellness, et cetera. And I bring this up because within a couple of years, we had, unfortunately, or within a year or so, we had the unfortunate issue with 9/11. And in my county, we actually had a sizable amount of our community members, first responders that left and went down to that scene and were unfortunately never to return. And that time period, I remember very clearly it happening and being at work when we saw the news. And then we mobilized. We brought in, and we're the health department. So what exactly could we do from that level? And I remember the Department of Social Services and the county exec and the commissioner said, hey, you did this great job with helping us through the West Nile piece. What can you do to help us with the community members who are calling because they're impacted with this significant, horrendous event? And I remember staying up 24 hours working, helping social workers and others navigate. And I looked at it from the lens of what you just said. What can we do and how can we respond? Even in moments of crisis, even in moments when our own concern for our safety, our wellness, because I had family members that were down there, colleagues, et cetera. And the reality is that was the moment when I reflectively saw the ability of our community and our collective field shining, right? We recognize that this is a significant traumatic event. Now, I'm not likening one scenario to the other, right? But to some, it feels that way.
Mm-hmm.
To many, it feels that way. Therefore, it is the lessons learned that we have amassed over the years that allow us to shine. Even when it seems that things can't get any worse, whether it's a loss of funding, whether it's a loss of programmatic, whether it's this even the concern that we know there are lives that are at stake, there are individuals that will endure harm as a result of policy changes or funding dynamics, et cetera. The resiliency that we can build and the muscle memory that we have in how to navigate those waters are things that we cannot lose sight of by only focusing on despair. That's kind of the point that I was making.
Yes. Ooh, that's good. And that's so helpful. And what a great analogy, a great story. That's very relatable, even for our younger folks that don't quite remember some of those stages. We always heard the story and know very familiar. And that's a great reminder and a great example here. It also made me think about just thinking about our network. And, and naturally we think public health. But you said something that reminded me, like I've been talking with my colleagues who are social workers. And because there's so much overlap in what we do in public health with other industries, as, we've all said plenty of times, but this is definitely an example of how we navigate tough times together. And it's definitely the public health folks, but we lock arms with like-minded colleagues who are focused on health. And that's how we gain our strength.
And, we have that affectionate caption that we see, especially when we go to the public health conferences, that we're all public health. And that mantra is something that I've, even in my work environment where I'm working with folks in a cross-sector based approach, and folks were like, well, I don't know if that's public health stuff. And, I'm an engineer and this, like, no, we're all public health. We're all health. We're all in this thing together. And going back to what I said earlier, right? Prior to this, we'd always integrated this concept of health in all policies, health in all approaches, because we recognize that whether you're building bridges, you are building planes, you are creating even AI technologies, there's still a health component in every last one of those elements. And by the ability to recognize, integrate, and focus on that as that combining thread, I think it helps us in how we can look at cross-sector, recognizing that everyone can understand, if we're able to communicate in a very effective way, why we're all connected with this particular lens around health.
Yeah, that's really good. Okay, so let's continue because this is good. And I'm feeling like, okay, I'm in the right direction. And this is sometimes we have to reset this on a daily basis because you may start your day out and by the end of the day, you feel kind of beaten down, but start the next day fresh and renew it and incorporate that into how you kick your day off. So what are some other things that we can do? Again, thinking kind of like the local level, because I feel like that makes it more tangible. Any thoughts?
Yeah, it's important, not only the education and understanding what are those levers within your communities, within what's within your reach, what's in your sphere of influence, right? So I know we started talking about, well, folks may think, well, I'm so detached from the national level, or I have a sense of no sense of hope that whatever I say is going to be impactful. And we've seen, course of time, people say things as well. You're right. You call your local congressperson, your letters and letters to the editor. What I tell people, and what I even for myself I find to be very important, as far as what does advocacy look like at the local level? How does that truly manifest? And it could be a number of things. Being active in your local community council. There are health sector basis of, I remember we would have these community circles, essentially, that focus on not only health and wellness, but maybe activities that allow individuals to bring their technical expertise to the table. It's one of the things that I would always say, took folks a couple of years in one of my community councils to say, what is an epidemiologist? Because they never heard of it. This
Right.
is prior to COVID, of course. It's always interesting trying to explain things and bring your expertise, whether it's a neighborhood, community, or even within, whether they're town halls to that extent, to truly make sure that your level of activity is tied to both your subject matter expertise and relatable to those who you're trying to force that connection and that understanding. So I found locally to be we've had group-ins, whether it's a local community center organization, they're sometimes public health priority or health sector engagement strategies that I've seen to be quite successful, whether they be a mixture of community-minded individuals or health industry like a health clinic, a health department, a hospital alliance. All of these things do exist. And our network has really been very strong. Even nationally, I would say APHA helped develop the Alliance for Public Health. And what that has done is really bring all these sectors together with ideas of how to take things from that perspective and bring it and filter it into the local lens or the state-based lens, or going back to your sphere of influence. So what I tell people is, or I tell colleagues or anyone who is like, what can I do? Where can I start? Start within where you are presently. And what are those, evaluate your networks, do an assessment of what those networks are. And how are they either activated towards addressing a common theme? It may be prevention. It may be addressing prescription medication, for example, or health access to all, or maybe more specific, such as substance abuse or education, as we mentioned, mental health and wellness, of course, sexual transmission. There are so many different areas and facets of that connection point, and it doesn't always have to have a label, right? You could be talking about maternal child health in a perspective of looking at breastfeeding partnerships, or specifically around communities, minority or other communities who have a pressing need that your subject matter expertise can provide that value and that understanding. It could be advisory support to local non-for-profits as they themselves are trying to navigate how to function around grant funding, or at least programmatic efforts or program evaluation to all extent. So I find that we don't look at all of the gems that are right before us. If I can be as polite to say this, back in the day before all this stuff happened, I always remember telling students that students would come to me, it's like, oh, I want to work at the CDC or NIH or the big name, the big three-lettered. And I would say, that's cool, but you should start local. You can look at your local community. You can look at your local health department and perhaps even your state health department, because that then gives you the on-the-ground expertise that will allow you to get into those three-lettered groups with a much more of a history, of much more of an understanding, and much more of a practical lens of experience. Those are some of the pieces that I would start with. And as I mentioned, a lot of the groups, including the health departments and others, have these kind of community collaboratives and others where they invite folks in to listen, to hear, and to provide that feedback. And I would say leverage those, because it does give you that understanding. And then, of course, we can get into the more quote unquote of the political, not in a sense of being a lobbyist, but being able to both take the lessons learned from these partnerships and to be able to impress them on the policies and the understanding and the priorities that your elected officials and others within that sphere are going to be understand their degree of importance for enacting change.
So I do want to go into that political next step, but before we do, I want to make sure I'm going to recap a little bit, because what I'm hearing is, and this is, I think, you dropped a lot of gems in there, and I think sometimes this is maybe kind of glossed over or kind of, people kind of blur that area. But really, you have to get involved and insert yourself in one of these places and find whatever's in your local area, something that's aligned with what you care about, and to really get involved to know what's even going on before you can even move to the next political step, if that's the next step. So I wrote down a few things, and it reminded me of a story of my mother. So my mother used to tell me the story when my siblings are much older than I am, but I have two older sisters that could be my mother. So that gives you an age, a big age gap there. But those two sisters they tell the story of a time when the schools were segregated. And they remember when my mother would advocate for the changes in the schools. And she said she would take her notebook and she would go to these meetings where she knew she wasn't welcome. But she would sit in that room, and she said that half of the time I didn't understand what they were saying, but she would sit in the room and she would take notes. And sometimes it was a matter of scribbling on paper, but they didn't know because her presence meant something, and it shifted the room and it made them a little uncomfortable. But by being in that room, she understood and she heard what the issues were, what they were talking about. She became very involved just by showing up to the meetings. Whenever there was a public meeting, she would show up. And I remember her telling that story, and we would kind of laugh a little bit as a kid. I didn't care about the story, but fast forwarding to where we are now, showing up in those meetings, if I start showing up in like a local town hall meeting, I'm going to find out what is going on, what the concerns are around me, instead of just waiting for the public notice to go up, but you just like being there and hearing about it. Also, we have a lot of coalitions around my area. So I thought that would be a good place, because those coalitions are like these heart-centered folks around the topic. And so, I wrote down those two, and I wrote down churches, because sometimes there's a lot of meetings, especially if it's a large church for the area. We have a few that are really large and have extended centers. Being a part of some of those meetings where you can just really start to hear what's going on, but then also being available to offer your expertise and become that trusted partner, not in a manipulative way, but if you're in there on a topic that you care about, and you can start to help them value what you do and that public health perspective that you can insert into the conversations. Am I on the right track? Because I'm getting some real good ideas.
You're on the right track. I mean, think about stories, just so many in our field. I often remember, and I think I may mention this to you in the past, that one of the biggest aha moments for me was that I used to go around, especially as the county epidemiologist at the time, used to go around to all the various towns that we had in my county just to participate in the meetings, being there and being present. And of course, recognizing that folks didn't know what the heck an epidemiologist was. But by the time when it came both to writing the community health assessment and doing the feedback that I would have as far as doing their informed group discussions or focus group meetings, to the extent and really hearing and understanding, I bring up the story for this one point. When I was leaving to leave from Rockland County to go to DC for NACHO, they gave a farewell at one of the big public meetings, and someone said, "What are we going to do now? Oscar's not here. Who's going to teach us epidemiology?" And before I could say anything, a couple other folks are like, "Oh, we know epidemiology now. He has taught us how to not just look at the numbers and say, well, this statistic says that, but actually understand what it means." And they started retelling what we will always want people to truly understand. It's not just to say the numbers say this, but what they truly mean. So they had become self-sufficient.
Yeah.
It was like one of those things you shed a tear. You're like, oh my God, I made epidemiologists out of everybody here. But it was so warming because the perspective of the impact, right?
Yep.
That you, just by being present, by participating, not trying to negatively influence, but just state the facts.
Yeah.
Provide the evidence or give the opportunity that when folks are going in the direction, it's like, have you looked at this? This is what this means. And this is how it really is truly transcends its impact, so that you are able to see. And this is why I think a lot of us have this love for the local level. You really get to see the impact of your work, the impact of your presence, the impact of your contributions in a much more immediate fashion. And it definitely has a sense of rewarding. So whether you're, as you mentioned, at a local faith-based institution or just sitting around talking to folks, identifying where their priorities are and how even a slight suggestion can help focus their interest in a way that provides a better result, I think you will see a greater sense of reward as a public health professional or health professional or whatever the profession may be by integrating with your community and getting things from the ground up, from a lack of a better word.
Yeah. Oh, this is good. Okay. So I'm going to be mindful of time. This is a role, but I would love if we could take a few moments and kind of take that next step that you were speaking to into that political arena, whatever that might look like, but share with us, expand on that a bit more.
The political side has always been interesting because folks may say, oh, advocacy means lobbying. I mean, and we can't get into this lobbying perspective. And there's two different things. To be an advocate means that you're speaking out for your topic of interest in your area and not necessarily one that you're just looking for, I would say, immediate financial result, right?
Right.
And there's, because of laws and everything else, whether you're in a not-for-profit or a governmental agency, there are certain things you can do as an individual and that you can't do as governmental or someone, you can't have that conflict of interest. But you are able to, going back to our skill sets, be able to look at both budgets of your local jurisdictions, the elected officials, whether they are a local town, village, or even the state, and then we get to the national and congressional side. You have that ability as an informed individual to both take that collective step of increasing your awareness of how things function, how programs are supported, and where the priorities are of those elected officials and understand it. So, for example, someone may have, well, I come in as a mayor or as I come in as a council person, and I'm really focused on increasing access to dental care services, right? Now, that's good because that individual has a passion. Oftentimes, it's tied to a story. Someone somewhere was impacted, a constituent, others. And that's where it becomes really relatable, especially as a public health professional, because we are gifted in the art of the storytelling. We are able to take both the data and the understanding to illustrate and how the programmatic intervention strategies that we crafted or we've shown to have that evidence, how those things can take things a step further. And we've seen the results of that. When people are talking about local community improvement plans, whether they're roads or services, we've seen the impact of us being able to both impress on these groups and these others the value of ensuring that you're not doing something that's harmful for individuals or for the environment, right? It's always that One Health approach. So those are the things that I talk about, those skill sets that you are now able, whether you're doing it as an individual or as a collective, as a coalition, as a community-focused entity, or even a national-based organization, to take that message to really both craft your message in a way up to what are those priorities and how they're aligned with that, either the needs of the community that are identified, whether it's a community health assessment, a county profile, or even a policy implication that you can look at your local community, at your state-based community, and of course your national lens. And those are the things that I think so many lessons are available of how to have those conversations, how to both not necessarily just write letters, but to go have we call them those site visits where you get to meet with your individual, whether you're an elected official to say, we represent this coalition, we're from a bunch of churches, we are from the Coalition for Healthy Families, for parents who are against gun violence or intimate partner violence. You have so many different avenues. The focal point is now to ensure that you are able to communicate that in a very concise manner and show the evidence, oftentimes from a graphical perspective, right? Infographics, like these are the things that are important. If you do this, this is the impact of that. This is why we need, both as individuals who vote for elected officials, et cetera, we need our collective voices to be heard so that we know if there is a reduction in funding to support, I'm going to say, immunizations in a school or in a community, whereas we're just seeing we have a major multi-state outbreak that could have been solved by virtue of vaccination, how you're able to leverage that vision or that visibility of that picture, their technical expertise and the messaging side to get to those individuals in the elected offices, and not just the individuals who are elected, the staff around them, the support mechanisms. Because let's be honest, they don't write the legislation. There are others who write it for them. And I found a significant value and positive experience by recognizing that collective network to be sure that they are the individuals who are properly both communicating and developing that message in a way when they're writing their policies that they're truly fed with evidence and illustrated by the value that your subject matter expertise. On the other side, you have the other approach that I would say, is very strong for engagement. Even your local media individuals who may be health reporters. Oftentimes I've found that a lot can be learned by talking to those individuals. When I've done these interviews, especially these media interviews, half the times they may end up with a 5-second soundbite, but I spent 45 minutes talking to them about the particulars of how to do a case investigation. Because while they're health reporters and they're in their field, oftentimes they don't have the full picture. And that's where you are able to both provide that education, provide that awareness, and once again, recognizing your skill set to be able to, and you can do this whether you're a student, whether you're a faculty, whether you are a professional, you have that knowledge and you are able to both impress and increase the awareness. And you find by having a better educated populace, they are better able to navigate and have an understanding of those health. So you're not the only one speaking about those health principles. That's the biggest thing, right? We may be one individual who feel that we can't save the world, for lack of a better word, but when you spread and you are able to impress and you magnify those reach and those networks and those approaches, that collective awareness, that collective understanding does provide that positive feedback in return.
Wow, that is so helpful. There's so much there for me personally because I've been writing letters and I think I've gotten on some of my state. I'm in a very red state. I'm like a blue dot in a very red state. And I've been writing a lot of letters. I think I've been getting responses back. I think I'm on some bad list probably, but that's okay. I've been decent letters, but I'm getting responses. So now I've been thinking years ago, I did take a few more steps and I remember having conversations and I remember collaboratively with a couple other public health folks from my state kind of going to meetings and talking about bringing the perspective, whether they were sincere or not, they were very open to the conversation. So lately I've been wondering, are they really as open to the conversations now? Should I pursue the next step of having conversations now that I'm getting responses? Kind of what do I do? I've been kind of halted from those feelings I was describing to you.
Yeah.
But this is very reassuring because I do want to press for it. And I mean, I don't want to go in with all my anger and rage, but we've got a long haul ahead of us. And I don't want to be sitting quiet, twiddling my thumbs and being angry in the corner. I'd rather go have conversations and maybe I can be of service in some way. You never know.
One of the things I recognize that, especially when we talk about advocacy and trying to separate perspective of ideology, personal beliefs, and even the political disparate nature that we've seen and polarization that exists. One of the connected points in all of that is the ability to find a common ground, right?
Yes.
And that's where to leverage, to your point, leverage that common ground to be able, because everyone cares about healthy children.
Yeah.
Name one person who says, I don't want healthy children.
Right.
So it's like, okay, if we're all committed to healthy children, then what is the best approach to help support that endeavor and the actions that will be helpful in obtaining healthy children and healthy populations to come? And I found that to be I had a major outbreak in a community that, everyone felt was so insulated, so isolated, but they value their families. And my breakthrough was not coming in from a perspective of this is what you're supposed to do as a health professional, but saying we're just focused on the children right now.
Right. Yeah.
They open doors. It literally opened doors. And I would say the same thing when you bring up the political dynamic, right, of speaking to elected officials, whether you go to your state elected officials or even go to national, you have the ability to make those connections and people are leveraging them.
Right.
My own mother, I always laugh about, I know where I get it from, my mom, but I remember my mom calling me one time. She's like, yeah, I'm in DC. I'm like, what are you doing in DC? Like, you didn't even call me or whatever. She's like, oh, no, this is our third visit down to the congressional office and we're talking to our congresspersons. And I'm like, wait, what? And she got very active. And she was like almost in her group of, it was nurses aides at the time. They wanted to get their message heard and they got in a bus and they drove down from New York City to DC and they were meeting with folks and they were getting feedback. And she was telling them her experience. And I'm like, yeah, this is exactly where I got it from. But it just illustrates that anyone can do it. And we can't be too scared to do it. And we just have to recognize that we have the skills. We just have to know how to navigate them in a way to truly ensure that the partnerships, the communication, and the resources, and there are tools out there to train you on how to have those conversations, how to focus on a short soundbite so that you're not coming in with like reams and volumes of data.
Right.
You only got 5 minutes to say your message. So how to really provide that for that additional follow-up.
Yeah, that's great because I've always operated by saying that, and really believe in this. When I am coming up against someone with different political views, like, I will say, well, we agree on the fundamental issue. We just don't agree on the best steps to achieve or accomplish, what we're trying to accomplish. It's just that with the overarching chaos that has surrounded us, it's like I started to not really believe that as much. But having this conversation, and sometimes I have to reset multiple times, by focusing a little bit more locally, it does remind me that, okay, I can relate to these people because this is the community I've lived in for a long time. And I mean, there are some extremes, don't get me wrong, but for the most part, like you said, leveraging what we have in common. When I approach these officials and I reach out to have conversations or whatever I decide to take next steps with, stay focused on the children, like you said, or stay focused on whatever that topic is, that health related topic is, and have these conversations. So this has been very good for me.
If you bring it down, and there are some folks like, okay, let's think more practical. What are those things, right? You have to look at what are the benefits and barriers for that partnership and that engagement, right? What are the beliefs? What are the guidance, the decision-making process, the values? What are the loyalties, right? What obligations do they have outside of their group? And what losses do they perhaps fear? Like, oh, I'm going to lose this if I do that, right? Your partnership basics are always function on that key understanding about the other. And of course, addressing, therefore, what are the opportunities to take that and leverage it, not for good or bad, but to ensure that let's figure out what are the keys for that strong partnership development, right? How do we build trust? How do we celebrate and recognize those contributions? How do we share our progress frequently? What are the mutual areas of benefit? How do we constantly communicate and identify the shared goals and vision, even though there's some disparity here and there? That's really some of the practical pieces that I found and others have found to be very supportive in building these partnerships, building these collaboratives, and leveraging them in a way to truly be that strong advocate for optimal health for all.
Yeah. Well, this has been great. I personally appreciate everything that you shared. It helped me quite a bit. And I just feel confident that our listeners are the same. So I'm going to make sure I let everyone know how to connect with you, especially on LinkedIn. But thank you so much for taking time to be here.
Always a pleasure. Always fun talking with you. And it's the part that I think we value the most in our field, that social connectedness, that opportunity for us to be refreshed. Because you re-energized me as well. I was like, all right, now, I'm pulling out all the stuff that became second nature. It's like, all right,
yeah,
I need to call. I need to make some stuff happen today.
That's right. That's good.
I really do appreciate you. And it's also a breath of fresh air to have this dialogue. And as you mentioned to your viewership or readership, it's helpful for folks to know that there is hope and there is a light, but we can't wait for it. We have to move towards it.
Yes, that's awesome. Thank you so much.
Oh, it's a pleasure, Doc.
I really hope you enjoyed that conversation as much as we did. We were so energized by the end of that conversation. I took so many notes during the talk, and I appreciate Dr. Alleyne for making time to speak with me and to share so generously as well. I knew I wanted to bring this topic up to the podcast, and he was the very first person that came to mind to have the conversation in the genuine, authentic, and a little raw and creative and innovative way. That's his style, and he did not disappoint. I was so happy about that. So I hope you feel the way that I do. I feel reinvigorated and inspired, and I feel like I'm in the right direction, and a little confirmation on that. So that is my hope for you. Now, if you are a member of the PHEC podcast community that I mentioned at the very top of the episode, I talked about how we have a new mobile app. We also have the desktop version or the app version. But that community, if you happen to be a member, or if you're not, then this is definitely a time to do it, because you can catch an extra bit of conversation that continued after the recording ended for this episode. I saved a special question that I asked Dr. Alleyne, and I wanted to provide it in our podcast community to keep the conversation going. Be sure to download the mobile app and join our community. Links to the community are provided in the show notes. You can find links to connect with Dr. Alleyne also and listen to the previous podcast episodes as well. Remember, he's just scored a hat trick on this one. So he's got 2 other episodes on our podcast. So if you have not heard those already, you'll find the links to those conveniently on the show notes page. So the show notes page for this episode, which is episode 406, can be found at phecpodcast.com. Once you're there, just navigate to episode 406 to find the show notes. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.